Patients often tell me that they feel trapped, forgotten, invisible, like the patient that we showed. And my heart ached every time I heard their stories. Stories of being misunderstood, dismissed, or told it's all in your head. But my office, we stepped to the plate. Hello, and welcome to another heartfelt episode of Unmuted, the Diaries of the Virtual Psychiatrist. I am your host, Dr. Muhammad Ali Refai. I'm a psychiatrist and a fellow traveler in this unpredictable journey called life. Now, today I want to speak to you passionately, openly, deeply about an event that changed all of our lives. It is COVID-19, coronavirus disease 19. Not just how it happened, but my unique role as a psychiatrist in how I helped my patients and the profound and often overlooked impacts on mental health and disability that it has had. COVID-19 hit humanity like an unseen asteroid. Suddenly, everything we knew about our daily routines, our interactions, and our basic sense of security was upended. But let's step back to the beginning. The origin of COVID-19 traces back to December 2019, emerging mysteriously in Wuhan, China, and spiraling quickly into a global pandemic, has now, we think, claimed millions and millions of lives. But beyond the staggering death toll, COVID left behind an indelible mark on survivors, a mark often hidden deep within our minds. As both a psychiatrist and an internist, I stood at a unique intersection. I want to tell you a story about my time at the National Institute of Mental Health. In 2003, I joined the National Institute of Mental Health in Bethesda, Maryland. And in our campus at the NIH Clinical Center, on the third floor, our offices were across the National Institute of Allergy and Infectious Disease. A famous character that has been known to the American people on television, Dr. Anthony Fauci, was there. I interacted with him on a regular basis. We did clinical rounds. But as his responsibility increased, we realized that he had actually taken more responsibility in the biological warfare role as somebody with the United States Department of Defense. Fast forward to COVID-19, 2019, 2020, Dr. Anthony Fauci, a person that I'd known and interacted with, emerged as the public face of the public health emergency and the National Institute of Health as somebody who had advocated for masking. Now, coming back to my role as an internist and a psychiatrist, I really stood at a unique intersection. I understood deeply that protecting physical health and safeguarding mental wellness are profoundly interconnected. And because of my responsibility to my patients and my population, I understood that I needed to step up to the plate, step up to the vaccine plate, and be able to help my community, help my country. And when the vaccines finally arrived, I felt that deep moral call to protect my community. And I enrolled my private practice, Blue Mountain Psychiatry in Northampton County, Pennsylvania, as one of the first and only private psychiatric practice that provided COVID-19 vaccines. This wasn't merely an administrative decision, it was a profound ethical and moral imperative. Alongside with my dedicated staff, my family even participated, my students, and members in the community. We vaccinated nearly 3,000 individuals. Many were struggling with psychiatric illness. It was almost 1.5% of the population of Northampton County, Pennsylvania. Patients with psychiatric disorders were not merely at risk for infection. They carried unique vulnerabilities, heightened anxiety, deep isolation, and a greater distrust toward healthcare systems. Vaccine skepticism was real. A lot of my patients didn't want to even get the shot, they call it. I ain't getting a shot. And it was also fueled by misinformation and fear. But using my training in motivational interviewing and behavioral management, I engage each patient personally, persistently, and compassionately, and provided them with the information that I had at that time. It wasn't easy, but the privilege of their trust was profound. Yet, vaccination was only part of the battle. The psychological war waged by COVID-19 was far-reaching and intense. Here I give you a video from one of my patients who suffered from the consequences of COVID-19. He will tell you his story, that he was completely normal before he was affected with COVID-19. And after that, he became severely disabled. Let's listen to his story. Hi, this is Dr. Refai. I'm here with Michael, and he's going to tell us a little bit more about how COVID has affected him.
COVID has affected me in a lot of different ways, mentally and physically, and it's really frustrating because I see a neurologist, but it only took me almost 12 months to get in to see a neurologist. But he's got me on the Parkinson medication to try and help control some of my physical problems. But I have good days and bad days because the amount of dopamine doesn't always get to my brain the correct way. So I'll have a really bad day where physically I can't keep my balance. I have to use a walker. And there's other days where I have a pretty good day. I just have to use my strong hand with my cane.
So prior to having COVID, you never had any symptoms? This shaking in your hand was not there? You were a normal person?
Yeah, I performed my job for the federal government. I mean, I had to be able to memorize all the wiring diagrams and work on multiple units at a time. I had no problem with any of that, lifting, moving, bending, crawling, whatever I had to do my job. I brazed, I soldered, I welded, but I just...
And now after COVID, you have this shaking in the hand and you have problems with walking and coordinating things. How about your thinking? How is your thinking?
I even have some like short-term memory problems. And like when I went to occupational therapy, I would run into the mental blocks where I just would lose myself and thought I couldn't concentrate enough on what I was doing, and that became a problem. And memory recall, reading stories and then trying to recall word for word, I would miss pieces. So it was really difficult and a little discouraging, but with my psychiatrist, the medications he gave me and the medications my neurologist gave me, at least I have some good days.
So there is hope for people who are having neurological and psychiatric issues with COVID.
Yes, it seems like there is hope for it. They say the earlier you get the treatment, the better off you are, but not all doctors follow the same techniques. So with every doctor, it's different. You just luck of the draw. I just happened to get in to see the right psychiatrist and the right neurologist, and my primary care followed up on everything. as far as getting my heart checked and everything else, because at first my COPD really acted up really bad.
Okay.
And it took a long time for me to get that under control, using a nebulizing machine a few times a day, down to I might use it maybe 2 or 3 times a week.
Very good.
So that's a big improvement, but some days I have just a really hard time accepting the fact that I can't physically do
Thanks.
a lot of the stuff that I normally can do.
Very good.
It's frustrating.
Thank you very much for giving us this information, and we have your consent just to show it to other patients or other doctors so they could learn how long COVID is affecting people out there.
Yes.
Thank you.
You have my consent.
Thank you very much.
Thank you.
Now, early data showed that patients with psychiatric disorders were disproportionately affected, more likely to contract COVID-19, more likely to experience severe outcomes, and more likely also to face death. But beyond the physical, COVID-19 unmasked a hidden epidemic of neurological and psychiatric illness, gripping millions in its aftermath. We now know that COVID-19 triggered and triggers an inflammatory storm within our bodies, affecting not just the lungs, but also the brain. Acute neurological complications, such as delirium, strokes, surged dramatically. Real statistics, people who had no history or exposure or risk factors to strokes developed strokes from COVID-19 and sometimes from COVID-19 vaccinations. Patients also reported ongoing fatigue, brain fog, memory loss, anxiety, depression, and sleep disturbances. And these persistent symptoms are not just mere inconveniences. They disrupted lives. They destroyed careers. They dismantled relationships. Research also has illuminated many things that have happened after COVID and told us who would have been impacted, pointing clearly to the prolonged inflammatory response affecting the brain. COVID-19 has been linked to profound changes in brain metabolism, or injuries, so injuries in the small vessels in the brain tissue, and disruptions in neuronal pathways, critical for cognition, emotional regulation. Patients often tell me that they feel trapped, forgotten, invisible, like the patient that we showed. And my heart ached every time I heard their stories. Stories of being misunderstood, dismissed, or told it's all in your head. But my office, we stepped to the plate and we helped with identification and administration of the vaccine. As some data showed that if you administer the vaccine and prevent recurrences of COVID, patients with psychiatric illness were less likely to face death. They were less likely to face complications. And here we have a video that is a memorial to our office and how we participated in the COVID vaccine effort. It is also vital to recognize that long COVID symptoms that persist long after the viral infection is resolved. This long COVID syndrome is genuine. It is a disabling condition. And the neurological and the psychiatric disturbances and damages that happen are real. They're measurable and they're profound. Many studies have confirmed that the neuropsychiatric impacts are severe of COVID, and that there were increased cases of depression, anxiety, and cognitive impairment months after the initial infection. It was not just simple psychological distress. It's not all in your head. It is a profound and neurological psychiatric illness that demanded recognition, compassion, comprehensive treatment and assessment, and even sometimes significant effort at rehabilitation, physical therapy, cognitive therapy. But COVID is not just a mere disease that revealed vulnerabilities. It also exposed the gaps in our mental health care system. A recent study in the Journal of the American Medical Association revealed there was a substantial disruption in psychiatric care delivery. A lot of our patients were afraid to come to the office because they did not want to contract COVID. But that created a significant disruption in their psychiatric care. They did not come to see their psychiatrist. They experienced psychiatric distress in silence at home. Now, sincerely, we talked about the effort of telehealth and telemedicine, and that those actually affected how we were able to provide services, because we acutely and immediately deployed telehealth and were able to provide services to individuals at home. Yet, disparities worsened. Minority populations, those with disabilities, lower income individuals, they faced greater barrier accessing essential care. This pandemic, the COVID-19 pandemic, didn't just test our immune system. It tested our empathy. It tested our resilience. It tested our humanity. Now, definitely there are lingering questions. How did COVID-19 happen? Where did it come from? Did it come from China? Is it a natural virus that has happened? Is it genetically engineered? We don't know a lot of these answers still till now, 5 years later. We also don't know its full impact on the brain, on the heart, on our cognition, on our memory. We still have no clear data on mortality. Even the vaccine that we came up with in a hurry, in few months, we tested this vaccine and we started giving en masse to half of the humans that live on the face of the earth a COVID vaccine that was tested for a short period of time. How much did that affect people in terms of their psychiatric symptoms? We don't know. A lot of these questions continue to be unanswered. But our patients, our fellow citizens, do deserve some answers. So today, as we face significant turmoil in our political system, we also face an urgent call to action as psychiatrists to provide some answers. As patients, as communities, we must advocate fiercely for expanded mental health resources. We must provide resources to our patients. We must provide treatment modalities to our patients. And we need targeted research to answer some of those questions, because the next epidemic is around the corner. I'm always reminded that sometimes, even when there's an epidemic and some of the treatments that are proposed seem barbaric, I go back to the memory of Dr. Benjamin Rush, who was the father of American psychiatry, who's a psychiatrist that was in practice in Philadelphia, Pennsylvania, during the yellow fever pandemic in the late 1700s. It was between 1780 and 1800. And Dr. Benjamin Rush, a psychiatrist and a physician at that time, proposed some barbaric treatments. He proposed the treatment of bloodletting. And what bloodletting is, cutting some veins in the forearm or the leg and allowing the blood to seep out of the person's body, hoping that this bloodletting would take away some of the microbes, viruses, bacteria that was inhabiting the body, and it was going to cleanse the body. But we found out that with bloodletting during the yellow fever pandemic in Philadelphia, more people died from bloodletting than died from yellow fever. So we do have an experience in our history where the treatment for a pandemic, more people died from the treatment rather from the actual pandemic. But our fight against COVID-19 continues, not just medically, in research. It also continues morally and emotionally. Now, as we wrap up, remember this. COVID-19 taught us painfully, yet profoundly, that mental health is not peripheral. People were cooped up in their homes. They were lonely. They were desperate. They were afraid that this vaccine was going to seep into their body, was going to seep into their home through groceries, through mail, through touchings, through the air. People were devastated. People were scared. And our role as mental health providers was to assuage the worries and the fears of our nation. So mental health was not peripheral. It was central, and critical, and inseparable from our overall well-being. Together, let us embrace this truth and forge a future that's rooted in compassion, resilience, and hope, because we are definitely going to need it for the next pandemic. It is coming. It's around the corner. It's just about to happen. So unless we learn lessons from this COVID-19 pandemic, we're not going to be able to advance. We're not going to be able to understand, not just as a virus and how we synthesize the vaccine for it and the mRNA. These are all questions that could be answered in due time by scientists and by researchers and by additional research. But we need to understand the significant psychological impact and the calamity that affected humanity. And we need to be ready for the next pandemic, ready in our humanity, ready in our compassion, in our resilience, in our hope. And we need to teach new medical students, what is it like to live through a pandemic? What is it like to have compassion? What is it like to be able to talk to somebody who's afraid that they're going to die from breathing air? Thank you very much for joining me on this journey. This is your host, the virtual psychiatrist unmuted, Dr. Muhammad Ali Refai, reminding you that your mental health matters profoundly. Take care of yourself and take care of each other. Until next time.